People often complain that non-alcoholic fatty liver disease risk is increased due to diabetes. Is this actually the case? Spectrum of liver disease: a friendly collaboration between doctors and liver-conscious patient. Dear diabetes-affected individuals, this is for you and your liver. As per Mayo Clinic, non-alcoholic fatty liver disease is where the liver is filled with build-up liver fat, where diabetes and your liver are collectively at stake. This condition happens in any event 50% of individuals with type 2 diabetes and near the portion of those with type 1 diabetes, and, in contrast to other liver issues, isn't connected to consumption and utilization of alcohol. The danger of building up this ailment is expanded by the nearness of diabetes, to likewise expanded by other ailments identified with diabetes, including obesity, hypertension, high BP, blood pressure and elevated cholesterol levels. The nearness of non-alcoholic greasy liver ailment is known to raise the danger of liver aggravation or scarring, cirrhosis, and is likewise connected with an expanded danger of liver malignant growth and coronary illness. In the event that you are diabetic and are determined to have non-alcoholic greasy liver illness, your GP may suggest an ultrasound review of your liver upon finding, trailed by normal blood tests to screen your liver capacity. Can type 2 diabetics eat liver? A telltale sign is that type 2 diabetes and liver illness appear to have an association. The liver is one of the objectives of some basic diabetic meds. The body needs the liver to help keep up typical glucose levels. However, when the cells in the body become impervious to insulin, the liver delivers increasingly more glucose and will in general get exhausted, in the end done working appropriately. Insulin obstruction that prompts liver brokenness as a rule brings about sort 2 diabetes. Liver compounds and their relationship with type 2 diabetes were assessed using calculated regression models. Scientists found that raised degrees of ALT and GGT positive relationship and the least degrees of AST/ALT negative connection is related to a higher predominance of type 2 diabetes and prediabetes. Summary: a huge amount of glucose stored in your liver can cause type 2 diabetes. The best explanation is when your liver sends out glucose during your low blood level, the sugar spikes as soon as you eat something, which slows down liver and stores glucose later, whereas, in some people's liver don't respond to this, at all. The liver diabetes: there is a hidden risk of liver disease from diabetes that most neglect. What's that? Having type 2 diabetes raises your chances of having a progressively serious type of NAFLD known as non-alcoholic steatohepatitis (NASH). For this situation, liver fat triggers unsafe irritation that makes scar tissue there. Tragically, NAFLD has scarcely any manifestations, making it extreme to analyze. A few people feel torment in the upper right piece of the belly, just underneath the rib confine. At times bloodwork will show an unexplained spike in liver chemicals that prompts the specialist to investigate. Or on the other hand, patients may have an output for another issue that appears there's an excessive amount of fat in the liver. Another sort of ultrasound utilized by liver pros can evaluate the fat substance of the liver and check liver tissue for solidness, an indication of scarring. Getting in shape is the most ideal approach to stop NAFLD and its increasingly forceful structure. How can I avoid it? Type 2 diabetes and management with diabetes and liver disease: as straightforward as it sounds, you need to generally weight reduction through eating routine and exercise can lessen the measure of fat in the liver. Now and again, corpulence medical procedure is endorsed. Treatment of related conditions, particularly cardiovascular illness, may require way-of-life mediation. This can incorporate halting smoking, holding weight down, ordinary physical movement and eating a sound adjusted eating routine. Maintaining a strategic distance from liquor is likewise acceptable direction, since moderate measures of liquor can exacerbate NAFLD. Summary: action plan: the best defense against fatty liver illness incorporates these techniques. Work with your medicinal services group to accomplish great control of your glucose. Get more fit if you have to, and attempt to keep up a sound weight. Find a way to lessen hypertension, high blood pressure (BP). Keep your low-density lipoprotein (LDL) or awful cholesterol and triglycerides, a kind of blood fat, inside suggested limits. Try not to drink an excessive amount of liquor. If you have diabetes, your PCP may suggest an ultrasound assessment of your liver when you're initially analyzed and customary follow-up blood tests to screen your liver capacity. Practice pearls. Serum ALT, AST, and GGT are effectively available and can be utilized to give a simple and prescient measure for assessing a person's hazard for type 2 diabetes and prediabetes. Raised ALT and GGT levels and diminished AST/ALT levels are autonomous, added substance hazard factors for type 2 diabetes and prediabetes. ALT levels appear to be the most prescient of the danger of type 2 diabetes in ladies. Lifestyle alteration treatment of type 2 diabetes in patients with liver sickness might be undermined by poor dietary status and general well-being. Over half of patients with the extreme liver ailment are malnourished. Various uncontrolled investigations demonstrate that weight reduction diminishes hepatic steatosis. The sturdiness of weight reduction on hepatic steatosis stays to be resolved. Low glycemic, low calorie consumes fewer calories with a weight reduction of 1 to 2 kg per week appear to be sensible. Low-fat eating regimens ought to have stayed away from. Some have recommended that a Mediterranean eating routine, i.e., high complex starches, high monounsaturated fats, moderate measures of wine, and low measures of red meat, is favored in patients with type 2 diabetes and NAFLD. Exercise improves fringe insulin effectability, yet not explicit to patients with diabetic liver illness.